How do we view healthcare in the United States? That's the simple question that brought Booz Allen Hamilton and Ipsos Public Affairs together to find answers. We wanted to know what people at the center of the issue think and feel about healthcare and its future. So we talked to consumers who use healthcare services and the providers who deliver them, primary care physicians, specialists, and administrators. What we found were three main trends, marked by anxiety, controlling costs, and technology. Anxiety about healthcare affects consumers and providers alike because the future for both is uncertain. Just 33% of consumers think the U.S. healthcare system is on the right track. 34% of the administrators working in and out of hospitals agree, but just 24% of primary care physicians and 10% of specialists think healthcare is headed in the right direction. Consumers worry that the level of care they have now and access to doctors they choose won't be available in the future. Providers are concerned about the financial viability of their practices. Out-of-control healthcare costs drive these fears, along with concern that the Affordable Care Act will make matters worse. All of the groups surveyed agree that controlling and reducing costs is essential, but they don't fully agree on how best to do it. Among providers, specialists are most likely to view tort reform as the way to go. Primary care doctors and administrators look most toward renewing our focus on prevention. Administrators embrace other changes too, including accountable care organizations and information technology. Administrators, it turns out, tend to be more forward-thinking and embracing of change than their colleagues, as they continually strive to position their organizations for future success. And technology may be the way forward. Improving and expanding technology provides countless opportunities to enhance care, communication, and collaboration between patients and providers. That, in turn, can foster prevention, reduce costs, and improve overall health care. Nearly 3/4 of providers expect their practice or hospital to increase its IT investment in the next 5 years. More than half also expect increased investment in new medical treatments and equipment. Meanwhile, the majority of physicians use computers or mobile devices during patient visits to access medical references, and more than 1/3 use them to view test results and take notes. Many providers also recommend internet and mobile apps for their patients to use. Yet while 71% of consumers have a smartphone or tablet, only 22% currently use them to manage or monitor healthcare or insurance. In contrast, 76% of consumers use social media, which marks an area for future connection between patients and providers. What else lies ahead? Only the future will tell. This first annual report provides a baseline from which we will continue to study shifts in healthcare and the ways that consumers and providers view them.